So welcome to the Managing Your Stress and Burnout workshop hosted by the Olive Branch of Hope. I am Stacey Ann Berry, your host and moderator for this workshop. And this is the first workshop of a 4-part wellness and finance series. I'm the project manager for the Olive Branch of Hope and coordinator, and have been involved with this lovely organization for the last several years in various capacities. So just a background about the Olive Branch of Hope. The Olive Branch of Hope is a nonprofit charitable organization founded by breast cancer survivors and has been serving our community for 20 years. Their services are designed to meet the needs of women diagnosed with breast cancer, to help them cope with the many emotional, social, physical, and spiritual effects of the disease. The Olive Branch of Hope promotes awareness of breast cancer in women with a particular focus on women of African ancestry who are often diagnosed at a much younger age than other ethnicities with a more aggressive form of the disease. So this evening, we have a dynamic lineup of speakers who will share tips and their expertise and strategies to help us all cope with anxiety, isolation, stress, and burnout, especially now during this health pandemic. After our guest speakers, I will lead a panel discussion, which will be followed by a live Q&A where each of you who have joined us will have an opportunity to ask them some questions. I will then provide a short presentation, which is an overview of the federal government and provincial government's COVID-19 health-related resources that a lot of us may not know is out there. So we are now going to jump right in to get started with our first speaker, and it is my pleasure to introduce our first speaker, Carol Sandy. Carol is a multifaceted clinical therapist working with individuals, couples, and families. Through her various counseling services, she assists people in breaking generational hurts, creating new career possibilities, and helping people discover their strengths. Carol supports her clients in establishing meaningful connections that build supportive conversations through self-evaluation while processing difficult emotions through efficient and careful execution. So please help me virtually welcome Carol Sandy, and you can use the reactions button and clap or wave your hand.
Hello, everyone. Thank you so much for being here. Really excited. And this is a wonderful topic and one that we really do need to focus on right now. So thank you. Can you hear me okay? In terms of what I'm going to share tonight, I'm hoping to just sort of offer people some direction around how to take care of themselves, what's important to them, around mindfulness and how we can just kind of get back into our body given the situation that we all find ourselves in. And so I hope to kind of offer that context, especially as we are all struggling with mental wellness, mental health in some form or fashion. And just to give a little bit of context around that, we are all impacted in some way or the other by mental health, mental wellness. And what I mean by that is mental health is all around us. We all want to be able to think and feel and experience the world around us, but we're very limited by that right now. And so I'm hoping to kind of give you a little bit of support around understanding that, but also recognizing that it's all part of us, that we all have to heal and come to terms with where we find ourselves in the present moment, and not getting too far ahead and not going too far in the past. And that's really what kind of happens when we think about anxiety. It takes us either too far into the future or too far into the past. And how do we kind of be in the moment and see where we are right now? That's all I have to share for now. If there's anything else.
So perhaps you can provide us with some insights around how people can identify symptoms of anxiety and depression and burnout.
Okay. So when we're looking at anxiety, when we're looking at depression and burnout, it's important for people to recognize that it doesn't happen suddenly. Typically, when we think about when we show up in our normal day lives, if we're sleeping longer, if we're spending more less time sort of communicating. So a lot of the times people that kind of sit down with me and they express, they're noticing differences in themselves. They're noticing their eating habits are a little bit different. They are sleeping longer. They are separating themselves from those that they care about. And so those are the small signs that we need to kind of pay attention to. The other part is that oftentimes we recognize that the way in which we have been giving to others, we have to be able to sort of put some boundaries around that. And we hear about this all the time. What are boundaries? How do I manage myself? So one thing that I would encourage people to do is keep in mind that when we think about boundaries, we want to make sure that we're paying close attention to who am I welcoming into my circle? How much time am I spending with people? If there are people around me that are bringing me down, or just finding that, we're spending a lot of time together communicating and complaining, or feeling really drawn away from what's important, maybe we need to reduce the amount of time we're spending with certain people. So recognizing that boundaries are helpful, and we talk a lot about boundaries for the simple fact it's telling us, it's giving us information. It's providing us with ways in which we need to sort of figure out who and what we want to who and what we want to spend our time with. And so it's going to be important that if you find more than usual, you're sort of taking things personally, or you're finding yourself not being able to respond the way that you normally would. Keep that in mind. How often is that coming up? Is that coming up when you speak to certain people? Do you hold on to things that may have happened in the past? Is it difficult for you to forgive yourself? These are all things that we need to do, that oftentimes when we feel drained or we feel really stressed out, those things are very important. Are you spending a lot of time on social media? Are you reading story after story on Facebook on what's happening? Just being mindful of that when we are spending a lot of time reading information, holding on to worries, these sort of things really cause us to be very uncomfortable within ourselves. The other thing that I encourage people to keep in mind is, are they fueling drama? And that's an important thing that I want people to be mindful of. If you are fueling drama, what I mean by that is that there's experiences that you're feeling people might be not getting along, and maybe you're adding to those discussions. And sometimes that often causes us to feel drained. If we can't solve a problem by having a conversation with someone, and you're not feeling like they're able to hear where you're coming from, I think it's important that you take inventory of those things. So the most important things that I want people to keep in mind is, take that inventory, feel the feelings that you're feeling. If you're recognizing that, you're tired and you're drained, not fighting that experience, recognizing that that's part of what we're doing together. If you don't ignore problems. If there's problems, recognize that maybe you may want to talk to someone, spend some time allowing yourself to be in the moment, and do check on people, and let people know you wouldn't mind them checking on them, have them check on you as well. Sometimes we get into this thought process, oh, I don't want to bother people, oh, I don't want to bring people down. The idea is that we're all in this together. Feel free to reach out to people, but also let people know, hey, next week I have some time, maybe we can chat again, or check on me. Usually in the morning I'm free. Make the intention of letting others know what would be a good time to reach in, check in with you. oftentimes we want to hold back on those things. And so it's important that, if you're seeing signs where things are going on more than 2 weeks, or you're finding it, you're really sort of lonely, recognizing that that's part of what we're all feeling, but don't be afraid to reach out. Don't be afraid to sort of ask for someone to check in to see how you're doing. This is the time that if we're part of a church community, we are letting others know. If we're not part of a organized church community, even peers or people that we know on and off, making the intention to check up so that we can have that normal process, as normal as we can be right now, in terms of just kind of setting the foundation. So it's important for us to be able to offer these pieces to ourselves and identify the issues or problems or challenges that cause us to have a negative response. Because at this point, we have to be our own coach or our own person that we kind of check in with ourselves beforehand.
And one of the challenges that we're all experiencing that has been heightened is the lockdown. So, I'm thinking about people who may have chronic illness and they're already battling with anxiety, and everything has been heightened because of the lockdown. Is there any insights or suggestions you can give, especially for those who may live alone, those who may be seniors, and not everyone can access maybe their organization or their churches physically, and they're having a hard time navigate this online world?
Mm-hmm. So, a big part of what I would encourage people to do is again, letting others know what they're feeling, what they're experiencing. Oftentimes I let people, remind people, what were things that you did in the past that brought you joy? Sometimes we throw everything out. Oh, I can't do those things anymore because, that was the past, or, it doesn't make me feel the same way. Or so sometimes it's important for us to keep in mind that what might have worked before might be what we need at this point. So if, you found checking in with, someone who was a goddaughter or somebody that, might have lost contact with, I would encourage people to do that. The other thing that I also let people know is that writing a letter, things that people would be like, what, is that helpful? But if there's something that, you used to do before and used to give you meaning, or oftentimes people are now, I'm seeing lots of people going back to knitting. Things with our hands is a very good way for us to ground ourselves. It allows us to create. And we saw that at the beginning of the pandemic. People are all creating things and coming up with things, cooking things. And it's because our hands, for many of us, it allows us to kind of ground and give us. So even if it's, sometimes I've heard people even bringing in plants that they would normally have and wait and do outdoors. They're bringing them in and trying to kind of grow certain things indoors, doing things that appear on the surface different because we are in a different time. So we do need to do different things. We need to think outside of the box. If music is also a really important part of grounding, listening to songs that, would bring us joy and in this, allow us to sort of breathe in and take in those moments, and even crying a little. This is a tough, difficult time. Allowing our tears to flow is refreshing to our spirit. And so recognizing that those things allow us to be who we are and accepting who we are. And, it's not a weakness at this point. It's recognizing that we are all in this together and that we have to try different ways to cope. And so I really encourage people to really walk themselves through this in a way that's not judgmental. Because what we know about when we get into the frame mind of being judgmental, why am I feeling like this? I shouldn't, or all of these pieces, it pulls us away from wanting to walk ourselves through feeling the feelings. And when we don't feel the feelings, we stuff the feelings down. So recognize part of it is feeling the experience as it comes up for you, recognizing that you have the tools, it's in you, and that every day is going to be different. And some days are going to be quite the same. And that's okay as well, too. And that we get to choose how we kind of manage our time.
So, any final thoughts on some activities or things that people can incorporate to help them cope during this time?
For sure. I think, one thing that I would like to kind of allow people to remind themselves around is when we find ourselves lonely, we find ourselves in a place where, that we might feel stuck, that every small shift we can give ourselves is a positive one. And that and what we're doing right now is we're giving ourselves small gains. Every day is a small gain. And so I think it's important for folks to keep in mind that when we look at small gains, it doesn't necessarily mean we're shooting for the top every time. What we're offering is small shifts. And so I'll just show you just quickly a little bit of what I mean by that. Can everyone see this okay? Maybe. So what it means to be ways to be kind to yourself. These are some examples to kind of consider how you've grown. Consider where you started at the beginning of this pandemic and where you are today. Forgive yourself for days that it gets really tough. It's part of the process. Celebrate your accomplishments. Celebrate the moments when you find yourself moving along in a way that's positive. It's not, it's not always going to be perfect. I really want you to as well keep in mind the importance of complimenting yourself. That there are going to be, moments that you do make gains. And sometimes we're so good at saying, that wasn't such a big deal. No, there's some shifts and some good things that you're doing. And remind yourself that it's okay to relax. Oftentimes, we're always ready to go, or in that place of, I want this to be over with. Just allow yourself to relax, allow yourself to be in the moment. And if somebody says something that's unkind, finding ways to respond to them, that's going to play a big role in how you show up. And so that's going to be important for you to keep in mind around this time. And so I'll share this and I'll just let people know that these are all things that I would encourage people to keep in mind. That we really do have to find ways to be kind to ourselves right now. It's easy to be very hard and judgmental. And this is important that we recognize that it doesn't get us where we want to go when we are in that frame of mind. So those are a few things that I would encourage people to keep in mind as they do a little bit of self-care, managing their feelings and their challenges, recognizing their triggers, people that might sort of impact us, but also within ourselves, how sometimes we might put ourselves down, or we may make ourselves kind of feel like we're powerless. What can I do? And so these things that we say, our self-talk that we share with ourselves, really it's another way of just kind of putting the lid on our progress. When we use those words, we cover ourselves, we show disrespect, which then puts us in a very vulnerable place a lot of the times.
I find what you're sharing to be very helpful because, so easy to go, go, go and maybe serve others and give more to others than ourselves and sometimes neglect ourselves and our own self-care. So we will make sure to share that those tips that you provided with everyone at the end. So thank you so much, Carol. If everyone could, maybe wave your hands or give her some claps for what she shared. And we
Yes.
are now going to move on to our second speaker. So it is my great pleasure to introduce our second speaker, Vidal Regisford. Mr. Regisford is a licensed psychotherapist and counselor who serves as a principal of a private consulting and clinical counseling practice. His therapeutic practices specializes in culturally adaptive cognitive behavior therapy, earned from the University of Toronto. Mr. Regisford holds credentials in social service work, community development, and postgraduate degrees with a master's in education, along with a doctorate degree in counseling and a postdoctorate degree in counseling psychology. He is also a licensed clinical supervisor, providing coaching and mentoring to clinicians and community engagement practitioners across the province. So please give a warm welcome to Vidal Regisford.
Good afternoon, everyone. Let me get my second set of eyes on. Here we go. That's better. It's great to be here. Thank you for the invitation. The question that I've been posed to speak about today is really about the caregivers and how caregivers need to take care of themselves while they're taking care of others. And so I've got a bit of a slide presentation for everyone here. I'm going to try and see if I can get through this technology here. So let's see this here. Okay. Now tell me if you can see this. Can you see that? Nope. Okay, that didn't work. So let's see here. I'm just wondering, I would have to be the host, would I not? Share screen, let me see how that goes. Oh, here we go, here we go. There we go. Here we are. I'm going to put that to the side over here. So, managing stress and burnout, tips and strategies to cope during a health pandemic, specifically for those who are caregivers, parents, frontline workers, and others who are caring for others. Let me go down here. So there's a slight difference between burnout and compassion fatigue. Burnout is when you are worn out, tired. It stems from both work and personal life. And it's usually over a long period of time. And the signs of burnout: anger, complaining. So think about your workplace where individuals might have been around for 10, 20 years. They haven't moved up. They're in the same position. And for the most part, they're negative. They just have a negative attitude. And you often wonder yourself, well, why didn't you just quit? But they don't quit. That's often an indication of their burnout. So they feel trapped, or in some instances, they just withdraw. They've lost their passion and enthusiasm for the work that they do. And it's not uncommon for those of us, certainly within the health profession or within the social service profession, to see our colleagues or know of others who are on a place of burn. And when we are burning out, we need to know that we're not in a good place and we need to take a step back. Compassion fatigue is slightly different. When you think of compassion fatigue, think about those who work particularly with others who have gone through trauma or who are going through traumatic experiences and those adjustments in life. And their proximity to those individuals create a secondary, or in some instances, vicarious forms of trauma. So they adopt the pain and the suffering of those who they're caring for. And it's unlike burnout, which is over a period of time. This can be situational or within a pocket. And of course, some of the signs of that are sadness, hopelessness, detachment, where some of the individuals just checked out. They just seem to be disinterested. So that's a slight difference that I thought would be important to talk about, and that is, what is burnout for those of us who are in the caring profession, and what is compassion fatigue. And compassion fatigue can be for someone who's not a professional. It might be an adult caring for an elderly person. It can be in any context. Okay, good. Let me go to the next slide. Symptoms of burnout. So there are 5 stages, 5 or so stages. So when you think about someone who's at work, that individual who's on the job, when they started out doing their job, whether it be they're a PSW, a nurse, doctor, and even our profession, those of us who are psychologists, psychotherapists, medical doctors, you start off, there's a honeymoon, there's a joy, there's an interest, there's an enthusiasm about doing the job. Over a period of time, if not managed well, the onset of stress can affect one's appetite. They become forgetful, they get their personal needs, headaches, the lack of focus, high blood pressure, poor sleep, poor hygiene, so not bathing, not taking care of themselves. They may seem distant, they're underperforming, they're irritable, and so on and so on. And so they show up, but they're really at a place where their enthusiasm and their drive isn't there, and then it begins to affect them in 2 ways: psychologically, yes, to an extent physiologically, and in their functional presence or performance. The third is chronic stress. So after going through the honeymoon, no break, no taking time back to breathe or to manage the burnout, no capacity to understand the signs of burnout, the onset of stress comes in. If the onset of stress comes in, all these signs are there, and in some instances, one might feel compelled to go to work because they're obliged to go to work. And the closest example I think we have right now are those who work in the nursing homes. They're burning out, and that is it's as simple as that. They're burning out. Going from one nursing home to another nursing home, or having to be there, on repeated shifts. So chronic stress, apathy, exhaustion, resentfulness, psychologically can begin to express bouts of anxiety, panic attacks. In one's personal life, loss of their sexual drive, loss of interest in going out socially. They may decide to take time off work and not really care about their teammates. Disinterest in hobbies. One indicator that I think is important, and we sometimes, when we've been in this job long enough, we sometimes experience this, and that's morning fatigue. You get up out of bed and you're not in the same kind of bounce that you would 10 years prior. You're just kind of dragging yourself out of bed. For the most part, what's going on in your mind is that it's negative thought, I've got to get up, I got to go into this job, I've got to do this, do that. That's morning fatigue. Might increase later on during the day, but it takes some time to get what they call your mojo going, or they've got to have their coffee or 2 coffees. Punctuality will be an issue, and they might engage in escapist behavior. And you can just imagine what those escapist behaviors might be. Overconsumption of alcohol. It could very well be that they're now consuming marijuana and coming to work while intoxicated. The actual stage of burnout. Physiological symptoms, stomach pains, digestive ailments. Again, poor hygiene, not taking care of themselves, not bathing, not grooming themselves properly. And a sense of emptiness, as though there's nothing worth living for. I'm just going through the motions. Pessimistic, and their peers typically hear this. Self-doubt that things can change, things will improve. And isolation, and a tendency for flight. This idea that whenever something stressful comes into play, or whenever there's more work, more demand, they take off. You can't find them. They're just gone, nowhere to be found. And the habitual burnout are those who are chronically sad, depressed, complaints of mental and physical fatigue. So they're just spent. And again, I think the closest example we have, again, are those in the health profession. I just was listening to the radio the other day, and it talked about nurses and how so many nurses are feeling that they're tired, exhausted. I think it was practical nurses, and they just can't keep up. They're just at a loss. They just cannot keep up anymore. That's burnout. Why? Because from March of this year, they have been going. I have a sister in England who's a nurse, and for 3 weeks straight, she worked. She worked 10, 12 hours a day for 3 weeks straight. No breaks, no vacation. And then you have the system or those organizations that require them to be at work. So symptoms of burnout. The benefits of counseling. And it's often hard to get an individual to see that they might need counseling or even more deeper psychotherapy. That's not easy to get an individual who's going through burnout to see that they have a problem. For them, they're already in flight mode. They want to escape everything. They just want to be away. They don't want to be bothered with anything to do with themselves or others. So what's really important is for them to get perspective. Get perspective in that there are multiple ways of seeing a problem. To be objective and to seek expertise, expert help. So when I talk about perspective, whatever it is that is going on with the individual, can they get to a place where they can adopt a different way of looking at how they're feeling and what they're experiencing? So if they're feeling that the work is too much, it's heavy, I can't do this, rather than going in another perspective, okay, well, can you take some time off? And when you take some time off, can you get someone to help with some of the household responsibilities so that you can rest your mind and rest your body? So counseling in and of itself isn't, I don't want to minimize it because it is a science and there is a science and methodologies to it, but it really is about helping an individual to get and adopt a different perspective to their problem, looking at the problem in a different way other than what it is. So today, for example, I was up in Simcoe working with an organization. They had a young boy, who's about 15, who had not seen his dad for many, many years. And the professionals were saying, well, you know, dad doesn't want to see him. And I said, well, how do we know that? Did anyone talk to him? Talk to dad and find if that's what he really wants, or is dad busy, or is dad frustrated with your organization that he doesn't want to have anything to do with you? They sat back and said, yeah, that's a different perspective. We never thought about that. Because once you open yourself up to a different perspective, you have a greater appreciation for change and a greater capacity to embrace a new way of looking at the problems before you. The second thing that counseling does is provides you insight, reflections on you, reflections who you are. What is it about me that has caused this problem? Or what is this about me that brings me here? Why am I here? What is it that this says about me? And to do that quietly and boldly and courageously. Oftentimes we don't want to look at ourselves, because to look at ourselves means that for some that we're going to judge ourselves. Well, the other side to the coin is by looking at myself, I can perhaps improve in some of the things that I'm doing or some of the decisions that I'm making that have had a negative impact on me. So this whole idea of providing insight to self so that you understand yourself better, who you are and how you function. Most of us don't do that. We think that the way we are is genuinely the way we are and that's it, that we do not have the capacity or the facility to see deeper within ourselves in a way that can help us to grow. The third thing that we try to do in counseling and psychotherapy is help the individual find ways, and we use the word coping. I like to use the term creative adjustment. Coping comes from a thinking that says, I just need to get by. What do I need to get by? What do I need to manage this? And some of the coping strategies that people have used have not been healthy. In fact, they've exacerbated their problems. Alcohol, tobacco, marijuana, drugs, pornography has not helped people because we've said, all you need to do is cope. Okay, so I go to work, I have a stressful day, I go home and I drink. Well, that's coping. Creative adjustment means that one is taking control of their lives and the issues in their lives, as well as looking for creative ways to work with that problem, work with that situation that might be challenging or confronting that situation in their life, that relationship in their life, through therapy or through counseling. Or in some instances, how do I breathe? So most of us shallow breathe. Very rarely do we breathe from our diaphragm. And it's interesting, when you take time to talk to people about breathing from your diaphragm, breathing from just above your stomach, people begin to realize, oh, it is distinctively different than how I was breathing. So when our bodies tend to become more relaxed. And the more you do it, the more relaxed you become. Rather than being uptight and breathing from this level, rather than from your diaphragm. And lastly, our aim is to equip the individual who's come to counseling with sustainable capacities for learning, healing, and growth. And I call it their resiliency quotient. So whenever you've got a problem, once individuals find a way out of it or how to manage it, then that gets etched in the back of their brain. When another problem comes along, they can go back to those tactics and those strategies and say, oh yeah, the last time this happened, this is what I did. Okay, so let me go back to step 1, step 2, step 3, and step 4. Because that seemed to have worked the last time I had a problem similar to this. So our role really is not to have people continue to come back to us, even though that might be the case, because some people enjoy that, but also to help the individual develop the skills and develop the ability to learn how they can heal for themselves and how they can grow and become more resilient. Okay? So, and I say to folks, look, there's a stigma about counseling, which is, I have a problem. Well, we all have problems. It's just a matter of an accordion. To what extent are our problems huge or small? But we all have some level of problems. The issue is, how are we coping? How are we managing? How are we finding creative adjustments around those issues in our lives? And I say to folks, look, think of therapy, think of counseling as having a conversation with someone who has no skin in the game other than to give you a perspective that is unbiased about what they see and what they hear from you. If you go to a friend, a brother, sister, there's a tendency they may be biased. But a therapist, a counselor, their best interest is you getting well. And so they're there to have that conversation, imagining that you're just sitting down having a coffee or tea with them and you're talking and they're providing you some perspective. I often say to folks, how would you then counsel, or what would you recommend to a friend if they were in this position? And often the individual says, well, this is what I would do, this is what I would say. And then I say, well, why wouldn't you do that for yourself? Again, it's about perspective. So the benefits of counseling: perspective, gaining insight into self, who you are, learning how to take care of yourself, and doing that in a way that it is sustainable. And I think I do have one more slide here, but I'm not going to use that yet. Yeah, I think that's it. Okay, so here you are. I thought I was finished. You guys got me for another 2 minutes. So, equilibrium, healthy adjustments vis-a-vis coping, or they can be synonymous. What is the aim? To create equilibrium, the condition of a system in which competing influences are balanced. Or it could be that you say, you're looking for balance. So the aim of counseling, the aim of psychotherapy is to help the individual get back to a place where they have equilibrium. Or in sciences, the big word, homeostasis. We learned that in grade 8 or grade 9 in family studies. This whole idea that one has balance throughout all areas of their lives rather than an imbalance. How do you do that? Well, the things that I preach to individuals are 5 basic elements to achieving that. Making sure that you're aware of your mental state, your emotional state, your social relationships and connections, your physical health, and your spiritual health. 5, just 5, no more, no less. And they're all interconnected to those inviolable dimensions to our identity, which 3 are mind, body, and soul. There isn't a 4th dimension to our existence here or our presence here on earth. None, as human beings. It's our minds, our bodies, and our soul or our spirits. And so fulfilling these 5 elements within those 3 domains or dimensions will help one create equilibrium or balance in their lives. So if anytime you may be going to school, but you're not physically exercising, you're out of balance. If you have good, healthy relationships, you're involved in your faith community, or you're able to meditate, you're physically active, but you're not doing anything to stimulate learning and growth intellectually or cognitively, you're out of balance. It might not be significant balance, but you're out of balance. And of course, dieting, exercising, social connections, learning and resting. Resting the body, resting the mind. Something I don't do enough of, but that's another. So I need to practice what I'm preaching. I need to sleep a whole lot more. And this one thing, think like a child. The other day, I'm not a fan of winter, but I've got to a place where I've had to make some adjustments. And so many, many years ago, when my kids were young, I had ice skates. And I'm telling you, I could probably sell them and get just the same money as I did like 10, 15, 20 years ago. That's how much I used them. But I've started to skate again. The other thing I started to do was go to tobogganing. So I go up to the hill and hear all these kids looking at an adult with a toboggan and say, yeah, that's right. Adults can have fun too. And so I encourage people to think like a child about ways of having fun and maintaining a level of balance in their lives. What do children have? They have good social relationships, good emotional connections. They're learning at school. They're physically active. And we do our best to create the right kind of environment that strengthens them spiritually. So think, and perhaps I should say, act like a child. Have fun. So I will leave it there. Yeah. Here's some tips. Challenge yourself. Take up a new hobby. Warm baths, cold showers. Science on cold showers and cold baths is fairly new, but it sounds to be good in terms of your mental health. Hiking, playing with your children, your grandchildren. Take a course, volunteer, walk in your neighborhood, visit new places, call old friends, journal, Netflix, have a Netflix marathon, cook with family, laugh. Just get out and do more and more of these things. So I think that is it for me, and we'll probably come back to some Q&As afterwards.
Thank you so much, Vidal. That was so educational, insightful, and informative. We really appreciate it. We're now going to move on to our third speaker, Kristalla Chu, and it is my pleasure to introduce Kristalla. Kristalla is a seasoned compassionate wellness leader for the past 25 years. She's a palliative care coordinator at the Scarborough Center for Healthy Communities and has worked in hospice care for the past 14 years doing community-based hospice support, including working in a hospital setting. With a background in human resources, she's recruited, trained, and managed teams, including HR managers and volunteers. She's developed and headed up Manpower Temporary Services Employment Equity Division. As a consultant, she's conducted diversity workshops for the World Bank of Canada across Canada. Kristalla was born in South Africa and is a seasoned Reiki master who has taught over 550 students in Canada and abroad and continues as an instructor. Her joy is being a daughter, wife, caregiver, mother, and soon-to-be grandmother. So please help me welcome Kristalla.
Thank you so much, Stacy. I'd like to just add that my new name, soon to be, will be Abu Chris, which is Granny. So I'm delighted. So I would like to first say thank you and how honored I feel to be part of this really important forum that you have coordinated, Stacy. And thank you to the Olive Branch for hosting this. It's really important work you're doing, and I want to acknowledge that. My objective is to share some insight about grief and bereavement, as well as the services that the agency I work for, and specifically the hospice palliative team provides, plus some of the many other programs by our agency. I'm going to also touch on some of the impact of living through a pandemic and how we have continued to try and meet the needs of our clients while having to think differently and to continue to provide services creatively. So I'd like to begin by telling you a story. It's my story. And it's a story about my husband and I and how we journeyed into his last days. It's a personal, intimate story. It's crushing, it's intimate, it's also life-changing. And I was in the midst of a whirlwind of emotions as we navigated the last part of John's life. We were also in the depths of our own selves. And being that we were both very passionate people and people that we thought we knew ourselves, we had a lot to learn from the whole experience. And then there came this crushing change. John was dying. We did everything together. We had a mission of doing healing work through the laying on of hands. And as we lived our lives around that, teaching and surrounding ourselves to being guided to do healing work wherever it took us. Then it seemed to morph into what I was doing. And it seemed to be that I was doing everything for John as opposed to doing it together. And I tried really hard to honor the fact that he had been a very traditional Chinese person, and he was the senior in his home. So there really was that piece of filial piety and respect. And I tried to really honor that and never take away his dignity and the right he had to feel that he was still the head of his house. And so we carried on living our lives. Work was still important. It paid my living costs, etc. But it moved to the background as we navigated the circles of healthcare treatments, the providers that came in and out, the surgery that John had, the palliation that was happening, even as I witnessed, and finally his last days. He went from having heart disease and diabetes to having 4 strokes, 2 heart attacks in total, and the second one was fatal. He lived through his body weakening and his mind remaining strong, such an oxymoron and so difficult to navigate. And as the diagnosis started to change with vascular dementia, some behavioral issues came up, and yet he was still my John. Fundamentally, he was still my John. His body was failing him, and his mind was weaving in and out of his illness, trying to hold on to his dignity and his most important part, the beautiful and lovely essence of his soul. As I watched and weaved in and out with him, dealing with the orchestra of healthcare around him and my own emotions, as I witnessed my husband's palliation, I went to work every day doing the same for other people. And I would come home and I would live it every day in my own home. I would be up at night, in the middle of the night, doing what caregivers do, helping to change someone because the bed is soiled, and then getting into bed and only to find that it's happened again. And so burnout and stress and frustration and finally learning to do what the laughing Buddha did, and that was learn to laugh about it, as we did it together. John had to move to a nursing home because we couldn't afford private care and I had to work. I learned much from that experience. I was on the family council, and then John contracted a virus 2.5 years ago. It precipitated a heart attack, and I watched my husband struggling to live. I did all of the things that I watched other people doing, and I helped other people do, and that we can't do today. I sat vigil with him. I held his hand. I told him 1,000 times I loved him because that's what he did to me. And this was what I had sometimes seen my clients doing, that privilege of witnessing that. The early hours of John's last day, his pain increased, and I had to request the night nurse to have a new order of pain medication. He was in the ICU. They were not treating him as you do in palliative care. And that was a real learning for me, seeing how the hospitals are segmented in their areas of expertise. And so he was in his last hours, and the doctor came, and he was administered the pain meds, and I held John in my arms and witnessed him taking his last breath. I was able to advocate for John. I had witnessed that and learned that from my peers and in the hospitals and at bedsides of other people. The difference this time, though, it was my husband, and John died in my arms. I was at peace, for I had walked all the way with him, honoring this traditional Oriental man as far as I could. I took his ashes back to Malaysia. All of his advanced care planning, I honored it to the point that we and the family back home for John actually scattered some of his ashes in the Indian Ocean. I performed some of the rituals when John died. I washed his body with the help of a nurse, and I was there at the crematorium when he was cremated. I couldn't do that in this pandemic world. I would not have had such an active role given all the protocols, and I would not have been at his side for 24 hours. I would not have been able to bathe his body. And the spread of infection risk is so high, together with the necessary protocols, that doctors and nurses become very focused on patient care with strict protocols and less time for compassionate care in seeing or getting to know their patient. And John would have been isolated. And that would have been what he suffered from most, that psychological and emotional trauma of being separated from me. Palliative care has uniquely been integrated with the rest of medicine today, given the short trajectories that people are working with in this pandemic, the trajectories of their health and end of life. Medical staff fear infection. They are physically exhausted and have moral injury when they cannot give more time and compassion to their patients, and they have to live with this. They become socially isolated from their own families. My own niece is a doctor, and her husband works in ICU, and he couldn't be present to her when she gave birth to their daughter. If I could not do those rituals for John, if I could not have flown to Malaysia, if I could not have had a funeral with 2 Buddhist monks chanting and the First Nations elders singing in a full high Anglican funeral service, this would have been my shadow loss grief, a phrase coined by the US thanatologist Cole Imperi. These would have been grief, but not from a death of someone. It would be the things that we lose or something that's taken away from us that we no longer have, and we grieve them. We see this with loss and grief from being far away from family, when we move away from our home countries, when we have to leave pets behind, we leave our family behind. My mother died a year before I immigrated. I experienced all of this in my early 20s. And then I took care of John for 9 years. I never grieved my mother because I had to get on with my job, finding a job, never mind get a job, get on with it. And at that time, you know what? I had no words for this. I didn't even know where to put this grief. This was my disenfranchised grief until one day when doing repetitive Tai Chi moves over and over, my own dam of pain and sorrow broke. And after 20 years, I grieved my mother and sobbed and sobbed, and I grieved my country. I acknowledged that I grieved all of this and I hadn't had words for it. I grieved my family. I wish I had had support groups I could have attended. I wish I had someone to talk with. But I want to share with you that Scarborough Center for Healthy Communities, here in our community of Scarborough, which is the size of Singapore, with such a diverse population, we have an amazing number of programs for you. And it's to these programs I will speak shortly. You may have heard of Elizabeth Kubler-Ross. She developed the 5 stages of grief: denial, anger, bargaining, and depression, and acceptance. However, she did not originally develop these to explain what people go through when they lose a loved one. She developed them to describe the process patients go through as they come to terms with their terminal illness. And now we recognize that we've gone beyond Kubler-Ross's 5 stages of grief, and we realize that grief is about losing something, losing someone. It is more important to feel what I'm feeling than trying to bottle it up, ignore it, suck it up, as I did almost for 20 years until my dam broke. The world is now in a pandemic. The person who is dying might transmit an illness that could be serious to their caregivers. The decision being made to restrict visitors in hospitals and so many other ways of life that's been impacted, including the value of human connection. It is not clear yet what the long-term consequences of these restrictions might be on bereavement. And please understand that grief and trauma go together, and we are only just feathering the surface of understanding what is happening on a global level. Dr. Harvey Chochinov, a psychiatrist and doctor at the Manitoba Palliative Care Research Unit in Winnipeg, said in an article published last June, the act of being present for a dying loved one can be an initial processing of grief, but often family members of coronavirus patients aren't allowed visits until the very end, and COVID-19 may be setting the stage for a tsunami of grief. That's staggering. We don't even know really what's going to happen to our world and all the changes on a psychosocial, psychological, emotional, spiritual, physical level. It's daunting. Grief and healing is a journey through time. It is personal and intimate. There is no timing or timetable. It is unique to each. I had to carry on, we all carry on. I met a mother who had not been able to grieve her unborn infant. She lost the child in pregnancy, and she came to one of my cancer support groups. And instead of supporting her husband, she finally allowed her own dam to break, and she talked about the infant, the child she lost before birth. There's no time. This lady was in her 80s. We've already heard how grief can affect us, and stress and so on. that we all grieve differently. It affects us in our bodies, appetite, we cannot sleep. I personally threw myself into my work, and we are in shock, we're numb, and there's disbelief. It comes in waves. There's no right or wrong way to grieve, just our own way. And people will shock you with what they say. Even some of the people that are the most close to you, your own family members, can say something like, has anyone hit on you yet? That doesn't even deserve an answer when you just lost the love of your life. Everything is going to be okay. No, they're not okay. The love of my life just died, or my sister, someone. It's been a year now, aren't you over yet? So it is better to listen and hold them in your heart and hold the space and say nothing if you don't know what to say. So here's a couple of ways to cope with grief. Try to separate from your previous expectation of yourself and of life. It's going to be different. You'll have a different lens. Embark on setting small, actionable goals. If you give yourself lofty things you have to do in a week or 2 months, you may not get them done, and then we become hard on ourselves. We've heard about the importance of practicing mindfulness, be it a walk in the park or doing your knitting. Talk about your grief with someone or in a group. It's therapeutic. It releases it. It's healing. Do meditation. Prayer is a great comfort. Keep a feeling journal. Even if you write just a couple of lines a day, it's healing to acknowledge your own feelings. Join a group. Seek therapy for traumatic grief. Listen and support someone through their grief by helping them to normalize their feelings. Don't judge. Don't judge yourself. Just know it's one day and sometimes one moment at a time. Try to understand and remember, if you're supporting someone, you cannot fix things. You cannot change family dynamics or a relationship that is now completed. And finally, send them love. And very important, give yourself love. So I'd like to touch on some of the services. I think I'm just going to go to the overheads and do it that way. Give me a second. Now, if I could only get this right. There we go. So our hospice palliative team, we have a palliative system navigation community team, and they are 4 nurses that follow each of the clients, and those nurses help to navigate the patient through the system. If there's any changes, they help to navigate them in and out of hospital care or to palliative care, and they are able to connect someone with the most responsible physician if the person doesn't have a doctor yet, and this is very helpful when you cannot make those hospital visits. The navigator follows the person constantly through the services, all the services that we have. So our bereavement care is a very important part of our organization. We offer one-to-one support. We do groups, and right now there's about 6 groups. I have a slide for that, but they meet virtually. All the groups are virtual now, right throughout the organization. And after an assessment, the person could receive one-to-one support from our bereavement coordinator, as well as from peer support, very well trained volunteers. And one of the things we have is a grief cafe, because in our society, we don't tend to talk about death and dying. So it's just a very open forum to be able to speak about that. These are our groups. Oops, there you are. For the grief group, therapeutic art, mindfulness meditation for grief group, a mixed loss group, so this is spousal and adult children. We do have a group, but it's not in process right now for infant loss. And we have a walking group, but it is not happening right now as well. We have a new group that's starting, and that is a grief support group for frontline workers, specifically as it applies to people who have experienced multiple losses responding to COVID-19, this pandemic. So the agency is really trying to respond and keep current with what's the need out in our communities. I'd like to share with you, am I okay for time?
Yes, about a minute.
Okay. I'd like to share with you our day hospice and the caregiver group. This is for individuals who are living with a life-threatening illness. It's an awesome forum to come to be seen, to be heard, and to feel safe and have meaningful exchanges. They're interesting and they're fun, and it's enjoyable, and it takes place once a week, and it's just starting now in February. I have another virtual caregiver group that's starting also the second week of February, and this is to support the caregivers who are looking after someone. And I learned a long time ago when I worked in and out of the hospital that a lot of people have never walked a journey with someone who is dying. And so to support them and help them know what's coming, prepare them, help them with some education, and to include now the whole thing around the pandemic and how it's affected people. Caregivers have to be very cautious about PPE and protocols, and it adds just another layer, and to help them with resiliency and empathy. We also have our hospice psychosocial spiritual care coordinator, and this person works in our team as well. They provide counseling, and they do quite a lot of the anticipatory grief, and also helping to liaise with families where there's some complex family dynamics, and provide some counseling. They may assist with some legacy work and memorial planning. They serve a very important part of our team. We have a new group for youth, and it is just starting this week, and I'm not sure if I can find it easily, but anyway, it's for young people who are experiencing grief, and it's very much on a holistic perspective, and we're very excited to offer that. Our agency is also very active in the community, partnering with the City of Toronto and Scarborough, Ontario Health Team. We're active with COVID in terms of the Equity Project, and providing information of outreach to neighborhoods, distributing personal protective equipment, advising about pop-up centers. So you can see quite active in the community. These are some of the programs that are active during COVID. Our food bank all with PPE and social distancing. Our transportation program is still offering service, virtual emotional support and counseling. It's all done online now. We have Meals on Wheels. This is still going on. Home support services where personal support workers are still going in to homes, and telephone courtesy calls. We have community health centers with full medical clinic, and we have interprofessional primary care, which work in conjunction with the medical clinics, where we have psychologists, nurse practitioners, foot care nurses, and finally my own team. I belong to the community hospice program, and these are all the active programs. And I think I've kind of exhausted my time.
Thank you so much. So, Christella, I must say your story that you shared is very powerful and heartfelt. And for many of us on the call who've lost a loved one and has gone through the end with seeing them lose their life, I mean, I did for my mom, can relate. And we really just want to thank you for your courage, your bravery, and your compassion certainly shines through. And the overview of the Scarborough Center services was really insightful and helpful. I have used it, the grief services, which is how I was able to connect with you, thankfully. And I must say, as someone who used it, they are excellent in terms of grief support and the resources. It is like a one-stop shop. So we're now going to go into the panel discussion. In the interest of time, I will shorten the questions. So the questions for any of you, feel free to respond for our speakers. What are some of the barriers in accessing therapy or counselors, especially as it pertains to, seniors or maybe low-income individuals or even people of color? So any one of you could start with your insights on that.
Sure, I can start. I think for many people, when we think about accessing services, is the financial aspect of things, wondering, can I afford it? Is this possible? Am I able to find a clinician that looks like me? This is a challenge for many people in terms of people that can understand their perspective. When we get into therapy, should I be worried about going into too much information so I can bring people up to speed? The other thing is just our internal barriers around therapy. So oftentimes we think, am I crazy? Is there something wrong with me? And I think, oftentimes we need to keep in mind that these thoughts and these ways of thinking of therapy kind of pull us away. Will the therapist judge me? And so, I think Dr. Vidal did a great job of just kind of reminding us that we all have challenges and we all have things that we want to get off our chest, and to use this as an opportunity. This is a person that's going to sit with you that is not going to judge. This is a safe space, hopefully, that the therapist can create for you, that there's one of the main skills that they do have is listening. And so oftentimes we were taught in the past not to talk about our problems and not to talk about things, and recognizing that this opportunity is for you to share what's on your mind in a safe space. And so when we think we take away those boundaries, the stigma of going and worrying about what other people think, just keeping in mind that the job of the therapist is to have you in their mind in terms of moving you forward to a better place. And that's what their main goal is. They're not there to judge you. They're there to support you. They're going to ask questions so that they can help you sort of get a better idea of bring them to where you are in that moment. And, oftentimes we're going to give you opportunities for you to motivate. And so that's kind of the hope around therapies, that we're giving you life skills so that you can create what works best for you. So we're always working side by side, not too much ahead. We're giving you the opportunity to walk alongside and really support you through it. So there are barriers and there are questions, and don't feel uncomfortable to bring that before even walking into the therapist room. asking those questions early on. Is there a way for me to pay less? Or, are there free services that you're aware of? We're a resource as well too. And so definitely use us to sort of help you, direct you through the process of therapy.
Thank you so much. That is so helpful. I think you've covered most of it. My other question, and either one of you, perhaps Christella or Vidal, you can answer. If a caregiver is reluctant to seek therapy, how can they be encouraged to see the value in it?
I think the first thing that we have to ask ourselves when we're looking at someone who has been reluctant is for us to understand, why would they go? Why do they need to go? It's an important question to ask yourself so that you're clear on the reasons why the individual will go, because more than likely they may be resistant. When you understand that question for yourself, then you can articulate to the individual why you think they should go. And if you are going to do that, part of that, if you're going to go through that process, part of that is you need to inquire what's going on. What's happening? This is why I think you need to attend. So you make the inquiry, you listen so that you can learn, you learn so that you can understand, and this is the most important thing. Once you understand, you are compelled to act. You can no longer opt out. It's ineffective and perhaps irresponsible to ask someone to go to counseling and not be with them on that journey or on that supportive path. So I got here inquiry. You want to be honest, identify what you're seeing, state why you think it's important, state the risks for not going, loss of health, affecting your relationships, the family. Do you see that your family life is being affected? You're not coming out anymore. You're not socially connecting, etc., etc. I see these things because sometimes the individual is so wrapped up in their problems that they can't see it. They've created a cocoon around themselves that they can't see what's going on. But you on the outside can look in and see what's going on. Ask them if they're resistant. If they knew someone who was acting and behaving much like them, what would they say? What would they do? And it's a bit of a conundrum, because if the individual answers and says, well, I think I would tell them to seek some help or what have you, well, then you ask them, well, why wouldn't you do that for yourself?
Mm-hmm.
Okay. And I think the last thing for me, second to last thing is, it's a bit challenging, but if it was a broken bone or if it was a serious physical problem in your body, what would you do? Would you sit at home with a broken leg? Would you sit at home knowing that you've got a cut in your arm and you need stitches? Or will you seek medical help? So we need to change our mindset around a mental, an emotional problem, and a physical problem. Physical problems we tend to want to act on, but those that are mental and emotional equally, if not more important, to our health.
Mm-hmm.
And last thing is, you commit to join them on the journey. Do not ask someone to go and seek counseling or seek support or help if you're not prepared to walk with them along the journey. And if they say no, keep coming back, because the first time, you're not guaranteed cooperation the first time or the second time. It may take them 6 months until they get comfortable with the idea. But if they're comfortable and when they're comfortable with the idea, you have an obligation, because you have engaged them, to join them on the journey.
Mm-hmm.
It is imperative, or it's far better for you to have not said anything at all.
Wow, that's very helpful. Christella, did you want to add before we move on to the final question?
I think that was all excellent. And I think maybe just adding that the people who are offering the support, they need to be transparent and create trust.
Mm-hmm.
And so when there's trust and respect, and you are seeing the person who you're talking to as the caregiver will be more open to listening, and it gives you a chance to at least explain what you can offer, because that's exactly what happens to me sometimes when I'm talking to clients about the caregiver groups. But when we determine that there's a lot of stress in the home and there's a potential burnout, this is when we step in and well, not step in, but we offer. And it's done in a gentle way and in a way to show people this is how we can assist. We can provide respite, just to be able to point out the benefits of accessing service as a caregiver and being able to speak with other caregivers. It's very helpful.
That's very helpful. Thank you for that perspective. And just the last and final questions around managing our stress threshold. There's a lot of things that are pulling and nudging at us in terms of contributing to our stress. So what would each of you suggest in terms of ensuring that those in our networks, whether it's our employers or for an entrepreneur, our clients, or even our friends and family, respect our boundaries and don't contribute to increasing our stress levels? So perhaps we could start with you, Vidal.
Two things. Assert your own personal power and your own personal power to say no. And know that it's okay to say no.
That's helpful.
Whether
Carol?
it be to family or to colleagues.
Wonderful. Carol? You're on mute.
I think in terms of evaluating the evidence, trust that gut. We have that thing that kind of is sort of trust that. If you feel or you're experiencing something, look at the evidence, against that worry, and give yourself the opportunity to trust that probably something is out of whack and that you might need a little bit of support, and recognizing that when we place our boundaries, we're standing up for ourselves, we're giving ourselves an opportunity to actually bounce back. Oftentimes we think, oh, am I soft? No, that we all have moments in our lives that we need to just protect ourselves. Trust that. Look at the evidence. You know yourself best.
That is so helpful. Thank you so much for that, Christelle. Any you'd like to add?
I think those are very important points. Just knowing how much we can do, and to be realistic, and to be able to say no. I'm not sure that I have a whole lot. I was so busy listening.
That's fine.
I was quite engaged with the last two, so Carol and Dr. Vidal. Thank you. I'm sorry.
That's okay. And each of you have been just a wealth of information. I mean, there's so many nuggets that I have taken that will help me in my personal life. And I'm sure many of the attendees on this evening's workshop. So I am going to open it up for a couple of questions. I know Carol, unfortunately, has a hard 6:30 stop and may have to leave. So if anybody has questions for Carol, please ask her now. And if you have time to continue, stay with us. I do have an overview of the government's programs and resources that are available. But if some of you have to leave, that's fine. So if you have a question for Carol, feel free to put it in the chat, or you can unmute yourselves and ask away. Please don't be shy. We want this to be engaging. And I know it's a lot to take in, and this topic is also somewhat heavy. So if you're not comfortable unmuting yourself, you can type it in the chat. If not, just unmute yourself.
I just wanted to thank the Olive Branch of Hope for hosting this discussion and all of the guest speakers. It's very helpful. I'm not a caregiver. I'm a cancer patient. I have stage 4 cancer, stage 4 metastatic breast cancer. So I was just wondering if you have done a similar type of workshop from a patient perspective.
Well, this is the first of our wellness series, and we would certainly be happy to have one that's more geared to a patient perspective, certainly.
Okay, well, thanks again. It was very helpful.
Wonderful. I'm glad you found it helpful, and thank you so much for joining us.
You're welcome.
Yes. Anyone else?
And I just want to say today is Bell Let's Talk Day. I'm a 35-year Bell employee, so that's why I'm wearing my hat.
Oh.
So it's nice that this type of workshop was held today.
Mm-hmm.
And every day should be an awareness for mental health.
Yes, it's very important. Thank you, Patrice.
You're welcome.
Does anyone else have comments or a question for any of the speakers? If not, I'll go right into
Yes, I do.
Oh, great. Wonderful. Wayne. Hello, Wayne. Thank you for joining us.
It's a wonderful information. My wife just pointed this out to me. She's part of the Olive Branch of Hope. But it's so great to hear the presenters here tonight. Thank you so much, Christelle and Dr. Regisford. Appreciate your comments so much. You know, I'm a pastor of a local church, and I deal with a lot of people who do caregiving. And so it's good to know that there's wonderful information that we could get in their hands. And I'm just trying to figure out now, how can I get some of this, what you shared tonight, into their hands? That's a question that I want to ask, because it's just good, it's good stuff.
This is being recorded, and we'll make sure we share it to everyone who registered and get it on the Olive Branch of Hope's website. So we'll make sure to share this information.
Okay.
Yes.
Beautiful.
Mm-hmm.
That's my question. Thank you so much.
Okay, wonderful. Does anyone else have a question or comment for the speakers before they go?
I'm just wondering if Pastor Wayne was referring specifically to perhaps getting the slide presentations for information that he could use, or was it just, or is he just satisfied with getting the recording?
That slide presentation would be fantastic, if that's possible. Those presentations in that sense, that would be great.
Okay, sure.
Okay, anyone else have a question? Serena. Hello, Serena. Thanks for joining us. Do you have a question for one of our speakers?
Yeah, I just wanted to say thank you to all the speakers.
We're hearing some background noise. I'm not sure. Yes.
Oh, just wanted to say thank you to the speakers that took their time out to just to, you know, talk about basically our mental health, and especially Christella.
Yes, Christella.
You know, her story resonated to me because I lost my mom, and at a very young age. Basically in my arms, like she was like,
you're freezing. Sorry, you're freezing.
At 22.
Oh wow. Okay, you were freezing, so we weren't hearing you.
Oh, sorry.
Yeah.
I was saying that it was quite painful to watch at 22 years old. You know, your muscles dying, and then later in life, like about 15 years later, my partner passed away, and suddenly, and I was trying to remember how it was for me, like once I lost my mom. I remember barely doing anything, not wanting to do anything and stuff like that. It took me a bit. But when I lost my partner, I think it affected me even more, because it was more like, you know, it was sudden, wasn't expecting it. And then to me, everything stood still. Everything stood still in life. While, you know, I felt, I don't know what the word is, but the way I felt with everybody else going on with their life, and I'm stuck. I don't know how to explain it, but it's more like, yeah, I was stuck in that moment, and I'm kind of upset, or, you know, or whatever, that other people are just going on with their lives. And, you know, it was tragic. It was like, you know, this is something that we thought would obviously never happened. But I resonate with what Christella was saying, because it's like, yeah, people will be like, oh, it's how many years now? You gotta get yourself together and all that stuff. And then that's where, my mental health started being compromised. And it's been like that for years now. And, when I heard about the grief, I never went through grief counseling. So I realized maybe that's something that I need, because I hear it more and more out there and then hearing that because of COVID, there's going to be a lot of grief happening, way down the line, the system's going to be overwhelmed, dealing with people that dealing with grief. So yeah, I just wanted to say thank you. It just resonated with me for sure.
Thank you so much, Serena. Thank you so much. Christella, did you want to maybe emphasize on the importance of connecting with the Scarborough Center for Healthy Communities? Maybe this would help Serena with getting out of being stuck.
Yes, Serena, I welcome you to call me, and I can direct you to the right person on my team. But I think we shared the same thing of that disenfranchised grief. And like you, I didn't even know what it was at the time. I was 21, for heaven's sake, when my mom died. I didn't have that knowledge. And yeah, it was frozen. And I often used to think, why don't I think about my mom as years, passed on? But it was almost, like you said, frozen. You just carry on, right? Because life has to carry on. So I just encourage you, if you feel that this is something you'd like to open to, I encourage you to do that, because nothing happens until we're ready. The universe is always on time. The sun always rises and sets. And if this is the right time, it's going to be your time to bring some healing to that. And in conjunction to the rest of the world, I believe it's like every drop in the bucket just keeps adding, and every drop, and we're the drops, right? Or we're the lights, and we count. So I just encourage you to just to come and meet us and see how we can support you.
Thank you for that insight. Hope that's helpful. Yeah. Thanks for your question and comments, Serena. So it is 6:33, and I'm doing my best to stay on time. And I do know that, Carol had to have left early, and Vidal also has to leave. Christelle, if you're able to stay with us for this part, that would be great. But if not, and you have to leave, that's fine. But I do want to heartfelt thank on behalf of the Olive Branch to our speakers, to Christella, to Carol, to Dr. Regisford, for your insights, the time you've taken out of your evening to share your knowledge, and for all of the attendees who are here with us and who are listening and engaged. And I really hope you find the information valuable and helpful as we're dealing with this very challenging time. And I want to encourage everyone to be optimistic and know that we will get through this together, and we just have to support each other and seek the help when we need it. So I do want to share what the government has available, because there is a lot of resources, a lot of benefits, and a lot of programs. And before I do so, I wanted to find out if Ms. Leela had any quick words or comments before I move into that section, just in case some of you have to go and you wanted to hear from her.
Okay.
Mm-hmm. Ms. Leela, we can't see you.
Just a second.
Okay.
Okay. Can you see me now?
Yes, we can.
If you can see me now. Thanks to all of you that came on. Thanks to Stacy that did such a wonderful job pulling all these wonderful, wonderful speakers together. Many of you I have never heard of, but I am so delighted that you came to share your knowledge with us today. Since we started 20 years ago, we've always been looking for speakers to speak on certain topics. But being a pioneer as we are, it's been difficult looking around in the community and trying to connect the right people. So this has been an awesome opportunity for us. And Stacy is so well connected. I am just thrilled that, that she was able to do this session for us today. So thanks to Dr. He's gone.
Vidal.
He's gone, Vidal, and also Christella, and the other lady's gone as well.
Mm-hmm.
And Carol is gone, but their knowledge is still with us, and of course they're going to be. It's going to be on our website as well.
Mm-hmm.
So I appreciate all of you coming, and to those of you that had questions, I hope you got all your questions answered, and I hope you're not like me that would get off this session and didn't say, "I wish I had asked this." And I wish I had asked that. So, but just in case that's you, please know that you can contact us at the Olive Branch of Hope, and we'll do our best to connect you to the right people that can help you if we are not able to. For those of you that are going through breast cancer or have had breast cancer, please know that we do have a monthly support group, and the next one is happening on February the 2nd. At 7 o'clock, and we deal with various topics on that as well. And so hopefully you will be able to join us for one of those. Somebody wrote me a note while we were watching and said this, wake up, we are having a great session. I said, I'm not asleep. I really was just grieving the loss of my daughter that I never had the opportunity to grieve. So I lost her about 30 years. So it has been very insightful for me as well, and very therapeutic. So thanks to all of you. Each one of you came with a different perspective, but each one of you had knowledge that we need today. And I appreciate that so much. And the Olive Branch of Hope appreciates that so much. So I hope that you will make yourselves available should we need you further down the road to do different sessions for us. And of course, we couldn't do it all tonight. So obviously there are going to be more. So I know that Stacy has another one planned that's coming up the end of
February 27th.
February, I believe. So for sure, that's going to be a totally different one. But again, it's knowledge that we need in our community. I want to say a very, very special welcome and a thank you to Pastor Wayne Russell for being on here. And I know I'm taking a little bit of time, but this is important. At least I believe it is, because as a leader in the church as well, I always remember when I was first diagnosed with cancer, and I notified the church, and everybody would just pray with me and send me home again as though everything was taken care of. It is not. We are still on the journey, and we still need the help and the support of our pastoral staff and everybody, and getting them to understand the journey that we are on is extremely, extremely important. So I've always wanted to find a way how I could manage, how I could get pastors in the room to understand that there is a life that we experience beyond the altar. When we leave there to go home, there's still so many aspects of it, many of which we dealt with today in this forum. So I just want to thank you, Pastor Wayne, for being here and even staying on the line even until now. I really, really appreciate that. So again, back over to Stacy, and again, thank you so much.
Welcome.
Thank you so much, Ms. Leland. Thank you, Pastor Russell. It's a pleasure to have you with us this evening. So I also want to give a huge shout out to our volunteers who are university students, specifically Alea Smith, who is working for the Olive Branch of Hope as a marketing assistant. And she's the one that designed these lovely flyers that you're seeing, managing the social media to promote these events and the other workshops we have coming up. So I'm now going to share my screen because I put together some very helpful information that I think all of you who stayed on the line need to know. And again, we're going to make this available on the Olive Branch of Hope's website. And so this has to do with what does the government have available. So let me see if I could do full mode. There we go, full mode, so everyone should be able to see. So just quickly, what we have available are some federal benefits, and you may have seen a news ad for this on the TV. There's a Canada Recovery Caregiving Benefit, which is so important. This is income support to employed and self-employed individuals who are unable to work because they must care for their child under 12 years old or a family member who needs supervised care. Applies to those experiencing school closure, right? A lot of the schools are still closed if they're sick, self-isolating, or at risk of serious health complications due to COVID-19. So each household can receive $500, which comes out to $450 after taxes, for each 1 week period for a maximum of 26 weeks. So this program is available via the CRA, and you can apply up until September of 2021 for this program. There is now the Canada Recovery Sickness Benefit, and this is income for those who are employed or self-employed who are unable to work because they are sick and need to self-isolate due to COVID-19, or they're having an underlying health condition that puts them at greater risk. And we've heard from the community that a lot of people are experiencing this challenge. This too is $450 for a 1 week period. And so for full details, the Canada Revenue Agency is your go-to. There's also thirdly, the EI, they now have the sickness benefit program. That's connected to those who may have gotten CERB and their CERB has ended. So they can now apply for this sickness benefit, which is under EI. So now I'm going to go over what the province has available. And there are several programs, all free. We need to use what's out there. So they have stuff for mental health and addiction through Connect Ontario. It's available 24/7. This is free and confidential health services for people experiencing problems with alcohol, drugs, or mental illness, or even gambling. So you can connect through Connects Ontario, which is funded by the Government of Ontario. Many of you have heard of the Centre for Addiction and Mental Health. They too have something very specific for those who have mental health and need support, and for those who are in the healthcare sector. And it includes access to resources, physiotherapy, and psychiatric service. There's specific help for healthcare workers, right? This is an ECHO coping with COVID program, and it's also for students who are studying healthcare and are dealing with the pandemic. So participants are invited to join the sessions virtually, even through video conference. They even have on their website past webinars that have some of the topics we talked about this evening, but it goes in very detail about burnout, compassion fatigue, which Dr. Regisford outlined, anxiety and loneliness. Those are just some of the topics I noticed on their website. They meet weekly Friday afternoons for an hour. Also, for those working in long-term care, there's some great benefits that are available via Baycrest and Northeast Specialized Geriatric Care for those who are supporting the elderly in long-term care. There's also internet-based cognitive behavioral therapy, and these are some of the therapies that can be expensive if you don't have the coverage, but through Morna Chappelle and Mind Beacon, you can get access to these programs, which is funded by the Government of Ontario, and this is specifically for those who have mild to moderate anxiety or depression. There's also a lot of support for seniors, very precious in our community, and those who are living with disabilities. There is an Ontario Community Support Association, and you can get this information just by calling 211 or visiting the website. Then we have Seniors Active Living Centers. Unfortunately, a lot of those places are closed, but it's still good to know where they are and maybe what programs they're offering virtually by connecting to your local senior center within the neighborhood you live. And again, you can find this just by calling 211. And there's also Senior Safety Line, which is available 24/7. And I highly want to just put out there that if you are in danger, of course, you want to call 911. But if it's something that you feel unsafe, but it's not life-threatening, then this is a resource for you. There's a benefit for Indigenous women called Talk for Healing. And there's also more support for caregivers. There's actually an Ontario caregiver organization that many of us may not know, and they provide support to over 3.3 million caregivers, ordinary people who provide physical and emotional support for those who are taking care of a family member, partner, or friend. And they have a lot of information, training, and resources. So especially those of you on the call who may be running a church or an organization, you want to plug your members and plug those into these networks, because it is funded by the government and there's many people who will need this. They all are now launching a young caregiver because the government has recognized that there are people who are as young as 24 or younger looking after their sibling who may be ill, or a parent, or even a grandparent. And so they have an online support group that meets every Wednesday at 7:30 p.m. There is a bounce back program for young people and adults with services available by phone. and they help you with anxiety, worry, and stress. There's also something called Mind Your Mind for those 14 to 29 years old, and the Kids Help Phone, which we've heard about, which youth can call, and another program for youth in university called Good to Talk, which they can use by text. Specifically for the Black community, there's a Black Youth Helpline, which is a great resource, and then the Black Health Alliance, which is a more holistic approach to healthcare as it pertains to the Black community. So that is just a very high-level overview of the services that are available. We'll make it available for those of you who attended and on the website. So here is the contact information and website for the Olive Branch of Hope. So that concludes the presentation and the session. If anyone has any last minute questions about what I just shared or today's session, feel free to ask before we just wrap up the session. So I see a lot of great thank you messages. All right, so I see that no one has any questions. So again, I just want to thank everyone who attended this evening's workshop and just wish all of you, all the best for the rest of the week. And I want to announce that our next workshop is going to be on a Saturday. So we're changing up the time. It's going to be Saturday, February 27th. And the topic will be financial planning and budgeting, tips and strategies to strive during a health pandemic. We do have a survey that we'll be sending. And in March, we're going to do a workshop on optimizing your health through proper nutrition and the importance of physical health and how you can build your strength while at home. During some of these lockdowns, it's important to stay physically active as well. So, thanks again to everyone and for staying with us a little bit past. I know we went over the 6:30, but I really hope you found everything informative and helpful, and just want to wish you all a positive and productive evening. So signing off, goodbye.
Thank you.
Thank you, Stacy. Well done.
My pleasure.
I will continue to share the flyers and the information.
Thank you, Sister Brenda. Thank you so much.
You're welcome.
Thanks, Stacy, for inviting us.
My pleasure.